Hi, Carol. This is James McDougall. How do I sound?
James, you sounded pretty good to me.
Thank you, Frank.
Mhm.
I'm in the Opportunity Building. A little bit of an echo, but other than that, it sounds good. Thank you. Frank, I just want to double check. This is James from Blue Prism. How have you heard anyone else speak yet?
Nope, we're in standby mode, James, but I can hear you just fine.
Thanks, Frank.
Hmm.
Good afternoon, ladies and gentlemen. Webinar is beginning. My name is Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. We really appreciate all of you participating here today in this educational webinar. It's hosted in coordination with Accenture. Accenture is a big supporter of the Dallas-Fort Worth Hospital Council. They sponsor many of our events, and they're a very active associate member here at the Hospital Council. Today's topic is robotic process automation in healthcare, and we're delighted that we have three expert speakers, and they're going to detail the very latest developments in RPA innovations in the healthcare market. In many ways, this is the future of healthcare as we optimize the business and continue to improve our patient care. This is a fascinating topic, and it continues a trend of the DFW Hospital Council providing education on the latest developments in healthcare. We're delighted that the three speakers that are with us today are Carol Durham, Managing Director of Applied Intelligence at Accenture, James McDougall, a Senior Director at Blue Prism, and Frank Catone, a Senior Director of Accenture's Global Intelligent Automated Solutions team. And we have other executives from Accenture with us, but I'm going to focus primarily on the speakers. And so without any further ado, I'm going to turn this over to our very first presenter, Carol Durham.
Steve, thank you so much, and thank you to the Dallas-Fort Worth Hospital Council for the opportunity to talk to you today a little bit more about something that we call intelligent automation, with a focus really on optimizing healthcare and improving the lives of the patient we serve. So we've all heard the buzzwords of intelligent automation, AI, RPA, and we're going to do our best to help you understand a little bit more about the continuum of tools that make up intelligent automation. And we've really focused on bringing you experts in terms of the people, process, and technology it takes to use intelligent automation successfully in your organization. So first off, your next interaction with a healthcare provider in the next 5 to 10 years may not take an actual interaction with a provider at all. You may be interacting with a virtual care assistant. So what you see on screen was So what you see on screen is an effort that Accenture went through as part of our innovation agenda with healthcare organizations to take a look at care management and care interactions redefined. So meet Ella. Ella is your new personal care assistant. Ella can help you, whether it is adding prescriptions and maintaining your medication list. It can send you medication reminders so that you take medications on time and you have better medication adherence. It can schedule an appointment with your provider if you need to schedule or follow up. It can book an Uber ride if you need one to get you to that provider appointment. It can record your mood and see if there are any areas of concern when it comes to depression or other things in terms of your mood. It can add or edit your insurance information. And it really focuses on doing what it can to keep you motivated through your healthcare journey, which can include integrating with things like wearables or even Bluetooth devices like scales if you think of patients who have CHF and are monitoring their weight. So Ella is the next generation of care management as we look at this broad continuum of healthcare. And this is something that we can do today based on the tools that we look at with an intelligent automation suite. Now I'm going to turn it over to Frank Catone, who's going to spend a little time talking to you about the continuum of tools that support things like a virtual assistant like Ella, and the tools in that healthcare intelligent automation continuum. Frank, can you speak?
Carol, this is James McDougall at Blue Prism. I hear you just fine, and I had Frank loud and clear a moment ago before you started. Frank, can you hear us okay?
I can. Sorry about that. Carol, thank you. Steve, thank you as well for allowing us an opportunity to address the broader audience. Am I okay on audio? Can you guys hear me okay?
Yes.
Thumbs up.
Excellent, excellent. So let's unpack Ella a little bit. Thanks for introducing us to Ella, Carol, and kind of how the interaction with a virtual assistant is near and dear and happening today. And so if you think about what is allowing Ella the ability to have a conversation with humans, what is allowing Ella the ability to understand the conversation and think ahead and take action and or think about how to help. This slide right here is what we call the automation spectrum, and a lot of these things are pieces of activities that allow Ella to do a lot of the things she's able to do. And what's kind of nice about the spectrum is a lot of these individual components. If you think about robotics process automation or cognitive, where you're applying some ability for a computer to understand, or as you're seeing with Ella, the ability to carry on a conversation with chatbot, or thinking about how these patterns are happening inside these machines, and could we, with these patterns, predict what is happening, and then the next step, which is if we're going to predict and understand, could we reason? Could we actually take some human reasoning? And so all these sort of things are things that you're probably doing today in some form or fashion inside your organization. But what we like to do is, while Ella's the front end, and that's where these conversations are going, behind the scenes, there's an awful lot of different sort of components that are coming together. So wanted to get the broad spectrum out there and wanted to make sure everybody kind of knew and understood and was speaking some of the same language we do when we talk about some of the things behind Ella. And so when I take this down to the focus of today's agenda, which is RPA, and where does RPA and or robotics process automation kind of help serve up and allow us the gateway to intelligent automation, I think we can go to the next slide, please. And at its core, you're seeing the slide actually build. What's happening is you're seeing, a section of things that people are doing inside an organization, and you're seeing, a section of what technology is doing inside an organization. And what we're talking about here from an intelligent automation perspective is the merging of what the people are doing and what the technology is able to do. And these software robots are able to start to mimic keystrokes, start to take actions just like humans would at their desktops, but they're also able to, through the use of technology, be able to be trained through some of the spectrum stuff that I talked about on the earlier slide. They're able to add some judgment into taking decisions or making decisions on behalf of some of these processes. So when you merge the collection of those things together, that's where we come up with the intelligent automation. So think of having a set of digital workers that are inside your infrastructure that you can train to look and act like people and handle some of your, we'll call them repetitive tasks, your remedial tasks, your basic blocking and tackling of back office suites of activities that are highly repetitive and not necessarily a lot of value, and be able to take that sort of workload off of a human and allow your software robots the ability to process that set of activity. And now you have the ability for your humans, you're freeing up their time and their capital to now spend more on higher value sets of activities within your organization. So I covered the broader spectrum of all the things that that kind of make up automation and intelligent automation, and I brought it back to a concept of a digital worker, which is a software robot that sits inside your infrastructure and is an assistant to your human workforce. What I want to do next very quickly is I want to kick it over to James on Blue Prism, because what's core to the execution of this intelligent automation strategy is the Blue Prism platform and its ability to act as that digital worker. And I know James is going to help us clean up a little bit of conversation about this software robot topic and how they're defined, and not all robots are created equal. So James, can you take it from here, please?
Absolutely, Frank. That's terrific. Thank you so much. So good afternoon, everyone. Thank you for joining. The graphic before you, it depicts three general types of process automation approaches. While many solutions hold themselves out to be robotic process automation, what Frank had referred to as RPA, or a digital workforce platform, the reality is that the various forms of process automation approaches are vastly different. They serve unique functions within an organization. And let me give credit where credit's due. So this threefold distinction that you're looking at was published by the London School of Economics. They serve as a global think tank for process automation strategy. They're the experts. Specifically, that group is led by its RPA thought leaders, Drs. Leslie Wilcox and Mary Lassity. So to provide you with a cornerstone of understanding RPA, first, please take a look at the block on the left, the one entitled Recorded Desktop Automation. It's pretty self-explanatory. You can read the bullets for yourself, of course. In this approach, the single human user literally records a script that they personally want to run from time to time. Whenever they feel it's appropriate, they're going to trigger it to execute. And this usually occurs on the isolated environment of that human's desktop PC, which, by the way, also consumes that PC's resources until the process finishes. Because of the personalized nature of the recorded scripts and the ability for humans to individually determine both their construct and their execution timing, processes that occur on a recorded desktop automation environment are necessarily simple. They are not complicated, and they absolutely lack the ability to scale and maintain adequate security. This is because IT has little ability. The IT department cannot control what the human scripts. And further, IT is unable to know what's been scripted, let alone manage the process changes. So that also renders them somewhat blind to impose security measures on this type of process. By its nature, recorded desktop automation serves a useful, but to be sure, it's a tactical, individualized function whose value is primarily to increase the speed of a low-risk, momentary process. It's worth saying that on its surface, a recorded desktop automation may appear inexpensive and easy to implement, but when scale becomes necessary, or when processes become even a bit complicated, perhaps interfacing with other applications, and certainly when security issues arise, recorded desktop automation very quickly gets in over its head. So moving to the right side of the graphic, you'll notice a block called SDK. That's a software development kit. Essentially, this block depicts a process automation strategy that's owned and operated by the IT department. I think everybody on this call, I'm sure, is probably familiar to some extent with this block, right? The SDKs, or IT-developed automation solutions, are seen as projects by IT. They obtain requirements from the business side of the house, and they craft a tailored solution which they code and own. As you may have experienced, delivery back from IT or operational use often takes exorbitant amounts of time due to coordination of competing IT priorities. And while the result usually works, it's inherently inflexible because IT must be the one to implement any change management. So for SDKs, or a tailored IT developed solution, to be effective, IT must understand the business need and speak the business language, which can be overtly or, of course, subtly challenging. So nevertheless, while expensive, rigid, and unresilient by nature, and perhaps internally even bureaucratic, with budgets and whatnot, IT-owned solutions are very likely to be secure and scalable, and certainly cooperate with the existing systems of record and compliance policies. It's also worth mentioning they may be culturally the norm, and so there's little to no transformational changes associated with this approach culturally to an automation strategy that uses this particular approach. And now to the middle block of the graphic, and really what we're going to be talking about in bulk for the rest of this webinar, sometimes called robotic process automation, or RPA. This digital workforce approach to automation puts the ownership of the business's process automation creation, its scale, its change management, and all the operational aspects of managing the automation squarely in the lap of the business side of the house. Right? So to be sure, it has IT's eyeballs on this, right? And that the security, the permissions, the policy compliance that IT would impose upon any human employee still exists. But it's the business who controls the process, and it's automation based on operational needs. So take a look at the next slide, if you could move that one forward. I'd like to demonstrate here or show, while literally just about any process can be automated, let me make clear that not every process should be automated or even partially automated. What you're looking at on this slide are attributes of the types of processes that are prime candidates for automation. Processes that have a high component of manual input and oversight, ones that frequently run en masse, that are rules-based, they're relatively complicated as to the systems or the people that it interfaces with. So these are the processes that generally deliver the highest return on investment. And for these types of processes, RPA delivers not only speed and accuracy, but true RPA takes massive costs and risks out of the business. And so specific to the industry that we're all in on this call, I'd like Carol to help you understand how RPA can specifically apply to healthcare use cases, processes that drive transformational improvement to the provider, as well as improving outcomes for the patient. Carol?
Thank you, James. So within healthcare, particularly for provider organizations, we're seeing RPA use cases span the continuum. Everything from pre-certification before a patient gets in the door around pre-visit and intake, all the way to claims and billing processes on the back end, and include some components of treatment, discharge planning, and beyond. For providers, use in administrative functions and claims and billing have been the initial places that have really driven some success in terms of the use of RPA, whether it is used for supply chain processes to automate POs or cart fills, whether it's something that we're using on the back end with claims and billing to be able to automate some of the claims batching and claims submission and claim checks. That's where we're really seeing some of the initial bang for the buck with RPA, but use cases are expanding every day. One of the things, especially in looking at RPA, that has been attractive for provider organizations is the fact that a solution like RPA provides a 24/7 solution, and I love the term compliance perfect. If you look at RPA, we know that the digital workforce is going to do the same thing every time based on a set of defined rules. And that's something within a lot of the claims and billing processes, supply chain processes, that has been very attractive about using RPA, even around things in the HR space like onboarding or some of the annual adjustments, things like that, are all processes that can be automated through RPA. And there are three specific examples, three use cases that we really wanted to share with the group today to highlight not only RPA, but how RPA can be enhanced through some of the other intelligent automation tools to create some really impactful things within healthcare organizations. So the first use case that we have for you today is a regional health system in the Northeast that asked Accenture to come in and take a look at opportunities, help identify opportunities to provide some automation in terms of revenue cycle, to speed processing time, to speed cash getting back in the door. And there are three use cases that were prioritized with the system. One was around pre-authorization, particularly for high-dollar imaging with commercial insurance payers. And they focused on two. They focused on Aetna and Cigna that both have a web portal that will allow you to go in and enter the patient information, enter the test that's going to be performed, provide the diagnosis codes, and then get an initial medical necessity determination and pre-authorization. That is a process that was automated using RPA. So it was able to take the current process, which could take several hours, depending on the amount of complexity, and it could automate that to a process that takes a number of seconds. And if there's any additional follow-up for these particular cases, those are things that are kicked out of the RPA process as an exception and provided to an individual with clinical background that could follow up, provide the necessary additional information, and then the process resumes. Another piece is secondary billing. And this particular organization was very focused around Medicaid secondary billing. And they were interested in being able to receive the initial remit from the primary payer, calculate the fee schedule versus the actual payment, make any contractual adjustments automatically to the patient account, and then go ahead and automate submission of the secondary claim and any additional contractual adjustments to go ahead and prorate that account. So automating that process for Medicaid secondary billing so that you aren't waiting for an insurance clerk or someone else to have the time to create that secondary batch and move it forward was a significant time saver and cost saver for the organization. The last piece is around reconciliation and bank remits. So the bot is able to access the remits that are coming from the payer organizations, and this is specific to professional billing or pro-fee billing. It was able to receive the remits. It is also able to pull the bank data with the checks that are received for the day. It's able to reconcile those two things. It's able to split the payment if needed to be able to get that down to an individual patient level, and then post that payment to the patient account, and do that in an automated fashion, which significantly saves time and significantly improves the time it takes to post that to the patient account and move it to a secondary billing cycle if necessary. So our next example is a little bit different. And this one starts to take a look at, particularly for breast cancer patients in this example, how do we begin to personalize healthcare for the patients who are coming in our door? How do we understand their preferences, whether it is a preference of how they are addressed by name, what is their preferred language, what is their preferred learning style? Are they able to process a small amount of information at a time or a large amount of information at a time? And then how do we provide education and training and follow-up and appointments based on patient preferences with a goal of improving overall patient satisfaction, reducing unnecessary emergency department visits because the information is provided in a time frame where the patient can consume it, and then reducing unnecessary hospital admissions. So specifically using RPA, in this particular case, it's a large regional system in the Midwest. They are looking at integrating data that's available in Epic with data in a CRM system to give them a 360-degree view of the patient. So as the patient presents for treatment and is identified as a breast cancer patient, a clinician will do an initial assessment to document preferences, to document any social determinant of health concerns, if they have concerns on how they're going to pay for treatment, how they're going to access treatment. All of these things are captured in an initial assessment and stored in the CRM system. The patient registration information is picked up from the Epic system via RPA and transitioned over into the CRM system to provide some of that initial documentation for the clinicians who are taking care of that patient. Then as additional clinicians, whether it's a dietitian or whether it's a psychiatrist, as they are interacting with the patient, they are filling out additional components of that consumer record to be able to continue to create this view and integrate across all of the different areas within the practice to provide that care to the breast cancer patient. a lot of times, while some of this information may be available in several different places, it just has not been served up in this way, in a seamless way, to allow clinicians to make decisions about how much patient education to provide, whether to provide that through a patient portal or through a web link or through email or even a link through text. Those are the kinds of things that this particular client was focused on by looking at RPA to help seamlessly integrate these solutions on the back end and serve it up to clinicians at the point of service. So our last example may seem a little bit intimidating, and this is definitely an example that you'll want to take a look at as you continue to mature in your journey with intelligent automation tools. But this particular piece, one of the challenges we've had in healthcare, particularly around readmissions, is a lot of times we're focused on LACE scores, and there's information that we don't have until the patient is prepared for discharge to be able to truly calculate that score. And sometimes that can lead to challenges in terms of preparation, which can extend length of stay or have other impacts for a patient. So we had a healthcare organization come to us and say, you know, we'd really like to create a better mousetrap in terms of predicting readmissions for our patients, and we'd like to know as close to the time they come in the door as possible. So we took a pretty extensive data set of clinical claims information, readmission information, and unstructured patient notes from the chart, from clinician notes, both from nursing staff and also from physicians, to be able to do some deep learning and some really deep data mining to identify characteristics that are common across individuals that are readmitted. And with that, use it to be able to put together a complex predictive model that would allow us to identify patients who are at risk of readmission earlier in the process. And it also includes some components of social determinants of health where you have issues in terms of access to medications, or you tend to have a population that tends to be lower income and has some challenges in terms of transportation or things like that. So this is one that we did that was really some exciting work to drive in and create a better mousetrap around readmission prediction, and then use tools like RPA to be able to serve that back up to clinicians as they are doing initial assessment, so the discharge planning can start from day one in terms of readmission prevention. So now I'd like to turn it back over to Frank and James to talk to you a little bit more. If you have a need, if you have areas of opportunity within your organization to be able to look at tools like this to drive some additional operational efficiency, how as healthcare organizations do we get started?
Yeah, thank you, Carol. And so for the group on the call, I can't see everybody's face, but I'm assuming there's some excitement, maybe a little bit of fear, given some of the technology that's been laid out there. But what you've heard so far is, you know, an awful lot of information around the various intelligent automation spectrum and the different components of it. You also heard the concept of software robot being equated to a digital workforce. And then you've seen some examples of potential automation opportunities, both across industry, as well as, you know, what could happen specific to your industry. And as Carol had gone through some of the use cases specific to healthcare, her point about the deep learning example, which is the last one she covered, her point about it's an opportunity for you as you consume this technology to go at your own pace squares off exactly with our recommended approach on how you get started. And so let's back up for a second and talk a little bit about how to consume this and get this inside your infrastructure and get you some maturity around this. And that's the sort of methodology you're going to want to follow. Oh, hang on, back up one second. Let's go back to the slide previous to this one, please. Yeah, thank you. No, that's okay. No problem. I could talk fast. I'll get us there. The thing you want to do initially is, while we're talking about tools and technology and processes and automating certain things, it's super important to understand a little bit of a high-level view of what is the potential automation potential or opportunities inside your organization, and what does that look like from a business case perspective. And that business case isn't necessarily how do you remove headcount, it's how you capitalize freeing up headcount, how you go about reducing time to value on processes taken. And so as you get some of that information together, you now have the ability to think about what could be an automation journey based on this higher level set of activities that you want to get after, including maturing some of the technology. So you start with a little bit about, hey, in my back office suite of line of business applications, there's these set of processes that may look and feel like good candidates for automation based on some of the criteria James had talked about earlier. And maybe that's in procurement, maybe that's in HR, maybe that's finance. And then you look at some other lines of business side and you come up with the same sort of set of criteria and think about processes that can make sense, and you boil that into a broader high-level strategy. Once you have that, then it becomes important to start thinking about how you initiate. And what you want to do and initiate is you want to start to get after a little bit of this maturity. You want to bring the technology in. You want to talk about the people aspect of what this means to have automation inside your infrastructure and a digital worker. You want to get comfortable for allowing that digital worker to operate inside your infrastructure. And there's some training, and we like to call it the human resource piece of this, right? What do you do with your human workforce now that they have a little bit of time on their hands to focus on higher value activities? In addition to that, how do you best leverage your digital workforce? How do you continue to add work into them since they're available 24 hours a day, 7 days a week? And so you start with the higher level set of activities, you get into a little bit of, let me get some of this in my infrastructure, get comfortable with it. Then you start to think about accelerating. Now that you have some maturity with a digital worker inside your infrastructure, now that you've got some discipline around these processes and how you translate those and how you get those into being something a digital worker can do, and it's processing in your production environment. Now what you want to do is go back to that initial set of activities you talked about and look for other processes to go ahead and feed into your automation infrastructure. And so that's how you start to begin about accelerating. You grab a couple processes from the initial book, you get started, then you go back and grab the rest of them, and you start maturing over time. And then you get into this sort of, now that we have an automation center of excellence in place, how do we go about and continue to leverage and push this sort of capability into our lines of business to continue to allow them the flexibility to get after things that they can use automation for. So I talked about a lot of things in here, and the reason why I wanted to circle back to Carol's example on that deep learning piece, on this slide, what it's not saying is go ahead and pick the most complex process inside your infrastructure and go ahead and talk about artificial intelligence, right? What it's talking about is, let's think about getting some plumbing in place around some core processes that look and feel consumable. And then as you, as an organization, continue to invest and mature your sort of capabilities in and around analytics or digitization of data, or as you start to have some of these other technologies become even more involved inside your infrastructure, go ahead and then add in more judgment and a little bit more of the intelligent automation capabilities on top of what you started. So that's why I just wanted to circle back on that one. Okay, if we can go to the next one. There are some key things that we see across the world with all of our clients, and this is a little bit of a fun list. It's meant to just be a little thought-provoking and give you folks some ideas of how to think about doing automation right. And I'm not going to read through every one of these bullets, but I'll combine a couple of them. You heard me focus a little bit on process and making sure we pick the right processes. So certainly there's a prioritization of the processes you want to get after and how you want to unpack those and automate those. And we like to say, at least amongst friends, we like to say, hey, if you have a fairly inefficient process today and it's broken, when you automate it, it's still going to be inefficient, it's still going to be broken, you're just going to get the answer faster. So be very smart about how you think about working with this technology and picking the processes you want to get after. And you heard me mention on the slide before the part about business case being critical for success. It's super important to have that sort of, what are we going to do with our human capital once we allow automation to be an assist to them inside their daily lives and their sets of activities. And so that part of that comes into that business case set of activities. There's the tools. There's a little bit about making sure that these tools, square off with what you're using today. You certainly don't want to go bring in a new set of tools. Maybe you have some OCR capabilities today that are fairly robust. And so how can you take something like a digital worker, how can you structure through the use of your existing OCR capabilities some of this unstructured data to allow a software robot to process it faster? And so think of those sort of ways of consuming tools. And then, of course, there is the, as you think about process automation and rule-based sets of activities that we talked about earlier, Carol laid out some examples of how to actually do a little bit of judgment-based sets of activities and doing a little bit of that sort of thinking and cognitive and predictive sort of stuff to, enhance the transformation on your digital workers. The last thing I'm going to do on this slide is just leave you with this thought, and that is, when you have a digital workforce inside your infrastructure, they need to be cared for and thought about just like a human workforce would, right? While they may not take vacations, they don't require benefits, they certainly have to be treated, maintained, and cared for just like a human workforce would. You have to train them, you have to make sure they're running, and there is some art around how you schedule and use them in and around your infrastructure. And so those are some of the basic sort of done right things that we wanted to highlight for this group. And we think about how you get started and how to consume it. What I'm going to do now is, James, can I transition over to you and, have you just take us home on the power of that virtual workforce and what that sort of digital employee, what that thing looks like?
Absolutely, Frank. Thanks very much. I'm happy to take us home. Let me just verify that the slide has changed, and there it is. So as we wind up this briefing and enter into, I think, what is scheduled for about 15 minutes of Q&A for the audience to share with us, I just want to summarize and really remind you that automation eradicates manual efforts in processes, and it frees up people to innovate and work on more strategic initiatives, as Frank said, to attend to patients with heightened care. I hope you've seen by now that if RPA is properly implemented and managed, it de-risks, right? It takes risk out of the organization due to its accuracy, and it takes enormous cost out of the business. And so far as Blue Prism's solution is concerned, RPA is not simply about doing things faster and cheaper. Instead, Blue Prism RPA can elegantly leverage your existing system, what you already have in place, your software that you already have in place, and artificial intelligence components and capabilities to provide your business with smart productivity and information that it cannot achieve or obtain this stuff elsewhere. So I think I'm safe in saying, I think we'd all agree that driving value and differentiation, right? Value and differentiation that ultimately helps patients have a better healthcare experience. That's the hub of all that we professionally do day in and day out. And of course, in our present world of, it sounds obvious, but I'll say it anyway, the extraordinary performance and financial pressures that we're under to improve our businesses, RPA is an attractive, it's a super high value, and it's a major tool that's going to enable you to deliver truly transformational care. Carol, would you like to take us into the Q&A session, please?
Sure, absolutely. So James and Frank, thank you so much for supporting the discussion and walking us through a little bit about the continuum around intelligent automation and the types of tools there, helping us understand the difference in automation solutions that are currently out in the market, and then sharing with us a little bit around RPA done right. So one of the questions, and James, I think this is something that you can help with. One of the questions that I get a lot is, what software tools and technology can RPA integrate with?
Yeah, well, I'm going to answer that two ways, Carol. Thanks for asking it. First of all, you're right. That's a question we get very often. And let me go on record by saying I'm not a technologist, right? I'm a Blue Prism employee who understands how software and the automation aspect of what we bring to the market can transform any enterprise, not just a healthcare enterprise, but any enterprise, to doing things in a much smarter, much more efficient, much more cost-effective way. One of the major, in fact, I think it's critical to the effectiveness of Blue Prism to be applicable to any enterprise at an enterprise level, is its ability to interface with or act with or raise the ability or capability of any existing system of record. And I go out on a limb when I say any, because it's a very dangerous thing to say always or never, but truly Blue Prism has yet to come across any software or any network component that it is unable or impermissible, frankly, to work with. And so one of the challenging and perhaps more pervasive software ERP packages, of course, is Epic. And Blue Prism's been demonstrated numerous times to be complementary and very congruent to interacting with all of the different modes and aspects of Epic, to include other ERP packages. So, Carol, that's a broad way, or perhaps a circuitous way, of saying there is no stopping in terms of a technology or a system, be it hardware or software, that Blue Prism as an RPA solution has difficulty or is clunky or clumsy interacting with. And in fact, it not only interacts elegantly with all of those different software tools and systems of record, but it elevates their capability across that intelligent automation ecosystem.
And Carol, can I just? Oh, I'm sorry. Am I cutting somebody off? Was there going to be a question?
No, go right ahead.
Oh, Steve, was that you?
Yes, that was me, but no problem. Go ahead.
Okay, sorry about that. I just wanted to hop on James a little bit with the part about the value of Blue Prism. When that question comes up about technology, it's important to note that the key aspect of Blue Prism is you're talking about interacting with a set of applications at a user layer. And that resolves the need for having to think about how does Blue Prism integrate directly into, a system of record like Epic or something else. What you're doing with Blue Prism is you're allowing the software the ability to, as a human would, go ahead and look at those applications, interact with the data in those applications natively, just like a human would. And then you're able to capture that information and train and bring that back into a set of things that the software robot itself, in this case Blue Prism, can then go ahead and execute just like a human would. So we actually see some organizations kind of use Blue Prism and RPA as almost like an API layer, if that makes sense for folks on the call, which isn't necessarily, I think the way Blue Prism is kind of going to market, but think of having the ability to not get involved with all that low level. I've got to go build an interface into a system and go into the application itself. Instead, I can look at it just like a human would and be able to go ahead and perform my task. So James, I just wanted to add that to a little bit of that technical piece, just to kind of help.
Thanks, Frank.
Carol. Yeah, Carol. Carol, this is Steve. One of the things I was going to say, for those of you on the webinar, if you type your questions, we've got a control here where we can read the questions to the three panelists. But while we're waiting on that, Carol and James and Frank, great presentation. I looked at this and so many different things were going through my mind. I thought back to when I spent most of my career in a hospital, and some of the pre-authorization you were talking about, the secondary Medicaid billing, but the practical predictive modeling that could come out of this could be enormous. And you used the breast cancer, but two things that I think this could really be beneficial as you look at adding value and differentiating yourself. Mental health. We have a third of the people that come to our emergency rooms have behavioral health issues. And you mentioned telehealth and how you could tie that in. The other one, and it really came to mind, you tied in the social determinants of health. I was talking to a pediatrician and an emergency room physician the other day, and unfortunately, if you have a child that has an asthma attack and they come for rescue medication at the emergency room, if they're going back to the same environment that has mold and mildew and roaches, they're going to certainly be back at that emergency room for rescue medication. And the parents need to be trained on when to use rescue medication and when not. So I can see a lot of value derived not only through the business model, but the clinical model. So that was just something I was going to point out.
Absolutely. And I think some of those chronic conditions, if you think of asthma, if you think of COPD, if you think of diabetes, if you think of CHF, all of those are areas where you are dependent on maintenance medications and making sure that those things are given regularly and that follow-ups are provided whenever they're needed. And one of the things that we talked about with Ella was the opportunity to be able to ask questions, whether that question is, how is your mood today, getting at some of the behavioral health indicators. And then what you see is you put predictive models on the back end of that says, you know, I see that you have marked that you aren't feeling very good for 3 days in a row. Do we need to go ahead and proactively get you an appointment with your provider to get you in before we have the ED visit or before we have an admission that leads to a greater cost? So I think that's one of the things that's somewhat the holy grail of what we're working on here. How do we have tools that help us impact patient behavior in proactive ways? And even pulling in some of the demographics around social determinants of health, how do we go ahead and link that to external data sources so we understand additional limitations or barriers that that particular patient may be facing that we need to figure out or help them work with. And I think you're seeing organizations like Kaiser Permanente in California that's doing some interesting things around housing and access in that space.
Do we have questions, Chris? I think the presenters did such an excellent job. We're not getting many questions, but you may have some other questions, Carol, that you routinely ask.
Well, so one of the other questions that I routinely get and a concern that I routinely hear is around HIPAA requirements and security of data when you are looking at a tool like RPA. So, Frank, do you mind talking to us a little bit about kind of the security around RPA and why people should feel comfortable if you are looking at using RPA with some of these protected data sets?
Yeah, and I'm going to ask James. James, I'm putting you on the hot seat because this is a true specialty of Blue Prism, and I think it'd be great for you to kind of get into, kind of the core on that, and I can bring it back to a, just in general outside of RPA.
Sure. So at a high level, again, not being a technologist per se, but at a high level, it's important to think of Blue Prism, the digital worker, right? The software robot as a human being, and anything that a human being is responsible for in terms of compliance, so is the digital worker. And so IT is not only responsible for, but also very capably can lock down the software robot to ensure that it's, as Carol said, perfectly compliant, 100%, so that it is only able to do and performs, as Frank said earlier, 24/7, exactly and only what it's supposed to do and has permission to do. So compliance, so long as the robot is trained properly, and I put trained in quotation marks, right? So it's so long as the business side of the house, the operations, deploys it correctly within its swim lanes of where it's supposed to behave, then it will maintain perfect HIPAA compliance, or it will maintain perfect regulatory compliance, whatever that regulatory issue might be. In terms of its technical ability or technical proficiency to maintain its integrity, to not be hacked, to not go outside of those IT swim lanes, that's a broader topic outside of this particular webinar. In fact, we do enablement sessions. Blue Prism and Accenture together do enablement sessions on security specifically because it can be such a concern. But on those enablement sessions, those workshops, we will show the provider organization or the payer organization how with their infrastructure and with their tools of record, how they can make sure that that digital software robot is locked down to be absolutely compliant and hyper secure in a way that, frankly, a human being that has feelings and errors as a part of our natural DNA will not. So that's, I'm not sure I answered that specifically, but hopefully it got people thinking as to a little bit more judiciously about why robots are favored. I will actually also say that doesn't mean they have to be on the premise. These can run inside the cloud. They can run inside Azure very easily, and in fact, that will lend to, contrary to what you might think, that will lend to the heightened security aspect of the process because of the secure environment that Azure maintains. It doesn't have to be Azure, but that's just one example. That makes sense, Frank? Did I soften that?
Yeah, you did perfectly. And let me just layer on top of that, Carol, this security question is part of that whole sort of, when you think about getting started, there's a little bit of getting some maturity and understanding going as part of your initial set of activities. Security is one of those comfort areas that organizations spend a little bit of time needing to understand, digest, and make it feel comfortable for their org. So while James laid out, look, these are digital workers that look and act like humans, it does culturally take a little bit of time for organizations that have security, compliance, HIPAA, all the things that healthcare organizations have over them. It takes a little bit of time to understand roles, access, IDs, the best way to set these up and allow them to cross different networks and infrastructure. And that requires a little bit of discipline. And sometimes we see organizations, especially in this industry that we're talking to today, they sometimes get a little flat-footed with consuming some automation because they're out in front of putting in some digital workers without thinking through some of that security and infrastructure set of activities that needs to happen to really lock this down inside the environment. So it's there, it exists in the platform. There's a little cultural adoption that organizations need to kind of get comfortable with. And there's some back and forth between IT, InfoSec, and enterprise architecture that kind of help model out how the human workforce is doing that today and what this digital workforce should look like as you consume that, right?
Good.
Frank, I'd like to also add that I mentioned hacking in my pontification earlier, but I want to mention that implies an external threat, right? That implies some sort of external entity or national sovereign trying to get into your records, which we all know is an attempt made by external bad guys every day, and we're not oblivious to that. We all know that's the world we live in. But Blue Prism also helps HIPAA compliance and helps with the ability to remain secure through insider threats as well. So it is, the software robot's actions are 100% documented. They are non-repudiable, and I don't even know if that's a word, but there's a non-repudiation factor that is associated with the Blue Prism process because everything it does is documented, archived, and auditable. So it's not only able to demonstrate what happened, but who it happened by, if in fact there was some sort of a change internally or externally, and it can, without a problem, stand up in courts of law. So it protects both internally and externally through its documented processes.
Good. And we have a question.
Yeah. In fact, we've got a couple of questions that are embedded. So let me read this entire question, but I think it's going to be a couple of parts to it. How do you handle a transition from digital to paper? For example, in the secondary claim example you used, most of those have to be printed and mailed, as most secondary claims have a paper and mail requirement. Secondly, how good is the ability to read scanned documents like checks for payment posting?
Both very good questions. So with an RPA process, so let's take both of those. The first one is a transition from a digital worker to paper. For that particular instance, RPA would be able to queue up the documents and put them into a print queue. I know for a lot of organizations, they may actually go to a secondary group that would serve as a clearinghouse that would do some of the printing and mailing for those things. So that's an option to transition to kind of queuing the documents that are required. There are also some processes where if that is not necessarily in play, then you can queue up those documents and then have them available for a person to then take that packet and organize it and prepare it for mailing. So there can be that back and forth interaction between a digital worker and a human component, and then going back to the digital worker. The next piece that you asked about was the ability to read check information or image documents. A lot of times if we're looking at using RPA with something like an image document, you have to start pulling in additional technologies like OCR to be able to scan that document, do the optical character read on it, to then translate that into text that can be used by the digital worker. So that's a way that we have seen things like that come into play, to be able to play with an RPA solution to do something like the cash read or cash posting. And particularly with the checks, these are things that we see today, right? We're all going onto the app on our phone. Mine is my Chase app. Maybe I shouldn't share that, but I'll go onto my Chase app and take a picture of my check. And it will automatically pick up some of the routing information and the amounts to be able to translate that. With that, necessarily, if it's a handwritten check, there are potentially challenges there, but there are definitely ways to read some of those checks that have the electronic printing.
Yeah, and Carol, you did awesome on that. Can I just add a couple quick things? I know we're up against time, but in addition to, the way you hand it off between RPA and a human, you could also use, at least in that printing example, that use case that was described, you can also use automation as a chance to validate and or handle some exceptions on that queuing stuff, right? So there's some additional load that an RPA sort of piece of that component can actually do that could also add value on the human side. And the second part of the question, where you were talking a little bit about OCR, it's a great example. Yeah, as you have existing OCR capabilities inside your org, those things may be tuned to a certain validation lever. It's super easy to punch out to something like, and I'll pick on Azure just because, James brought up Azure a little earlier. In addition to your OCR set of capabilities you have today, if that comes in at 65% valid, you could punch whatever's left, that 35% left, over to, Azure, and immediately get another 10-15% sort of lift on, is this stuff cleaned up and is it structured and digitally put in the right sort of place, and can a software robot take it from that? So you have an example of using what you got, augmenting it with some tools that are out there in the ecosystem, and allowing Blue Prism itself, in this case Blue Prism, the software robot, the ability to handle some of that structuring and stuff. And so there's lots of ways to get after the ability to capture. That question, though, is super. The ability to structure data, to take unstructured data and structure it, is absolutely critical to allowing automation to kind of run its course, right? So I just wanted to give you some extra stuff on that, Carol, real quick, right?
No, and I'm going to dovetail into that if I can, just with 10 seconds, saying that Blue Prism is not only a smart RPA that incorporates those smart tools, but in terms of healthcare automatable process examples, report automation is just one of them. There is no process within the revenue cycle management or unbilled analysis or claims adjudication, clinical denials, or some of the processes that Steve had mentioned that are not automatable, but the devil's in the details, so to speak. This would require an organization such as an Accenture to come into the organization and look to see what the current process is, where it's manual, what tools exist, and to provide an assessment.
Yep, and James and Frank, I think we are just about at time. For the audience, thank you for listening in. Our contact information is provided on this slide, or I know that Chris and Steve both know how to get a hold of us. If you have any additional questions, or if you'd like to talk a little bit more about how we can tailor some of these things for your organization.
Carol, I do have one quick question for you before we go. Is this a proprietary presentation? Chris has the ability, obviously, to record this, and it'll be made available for people that weren't able to be on this webinar. But also, if you would like, we can post the presentation, but I'll defer to you on that.
Absolutely. So that was some of our thought process in putting the presentation together, was that we could make this available to the DFW Hospital Council to be able to post as well. So we'd be happy to do that.
Well, we certainly appreciate this. Has been very informative, and we thank you, Carol, and Frank and James, we thank you as well. This has really been very educational to me, and I can only imagine the people that are really in the trenches in the hospital, it's been very helpful to them.
Excellent. That's our goal. Thank you.
Yeah, you're all very welcome. Thanks for letting us participate in the session.
Indeed.
Cheers, everyone.